Hi, my name is Jocelyn Colhart, and this is my presentation on heartworm disease. What is heartworm disease? Heartworm disease is an infectious disease caused by the parasitic worm Dirofilaria imis. This disease gets transmitted by multiple species of mosquitoes as they carry the larvae of the heartworm. Heartworms mature into adults and lives in the dog's heart, lungs, and associated blood vessels. Then the female worm will mate and release her offspring into the dog's bloodstream. So when the mosquitoes bite the dog, the larva can be then transmitted to another host. Heartworm disease in dogs is chronic because it is a progressive disease and hard to detect in early stages. But because but becomes worse over time as heartworms mature and multiply, causing arrhythmia like bradycardia and tachycardia. This happens when the worms grow too large and take up too much space in the heart and lungs, resulting in chronic inflammation, physical blockage, and high blood pressure in the pulmonary arteries, which results in affected organs to work which results in the affected organs to work harder, leading to heart failure and fluid retention. There are different levels of heartworm disease, for example. Class 1 no symptoms or mild symptoms such as occasional cough. Class 2 mild to moderate symptoms such as an occasional cough and tiredness after moderate activity. Class 3 more severe symptoms such as sickly appearance, a persistent cough, and tiredness after mild activity. Trouble breathing and signs of heart failure are common for Class 2 and 3 heartworm disease. Heart and lung changes are usually seen on chest x-rays. Class 4, also called Caval syndrome, there is such a heavy worm burden that blood flowing back to the heart is physically blocked by a large mass of worms. Caval syndrome is life-threatening and quick surgical removal of the heartworms is the only treatment option. The surgery is risky, and even with surgery, most dogs with Caval syndrome die. This disease is important to discuss because if not treated it will end in death as the worms become too abundant and the dog's organs aren't able to function properly. Clinical signs include occasional cough, lethargic, persistent cough, trouble breathing, heart failure, and in severe cases death. The body compensates by the heart and lungs will work harder, resulting in an increase or decrease in heart rate, thickening and hardening of arteries, inflammation of the lungs, enlargement or stretching of the heart. The vet will use the dog's blood to check for heartworms. The vet will test for the protein or antigens of the heartworm with the blood taken from the dog. There is another test that can be done as the tests for microfilariae is by also using the blood sample from the dog. The terms I used are arterial, reference to anything relating to arteries, the blood vessels that carry oxygenated blood away from the heart to rest from the heart to rest of the body. Itis, inflammation of a specific body part or organ. Lethargic, a significant abnormal decrease in pets' energy, activity level, and responsiveness to their environment. Chronic, a disease or condition of this long-term persistent over an extended period, typically defined as 3 months or longer, or is recurrent. Tachycardia, an abnormal rapid heart rate that exceeds the normal resting range for a particular species. Bradycardia, an abnormally slow heart rate for specific species in size and physical state. Arrhythmia, an abnormality in the regulatory or sequence of an animal's heart rate or heartbeat. These are my references.